Good afternoon to all. Today I am here with the session regarding disease of hair and its homeopathic management. I know what in this era we all have what this problem faced not only by men but also women. Both are equally facing this problem, and as our lifestyle has changed, it has also got a very major role in this condition. So now let us see what are this disease of hair and how we could manage it with our homeopathic medicines. Now, this is the structure of the hair. As you all can see, we have the hair is a part of epidermis, and it has mainly got two parts. One is shaft and one is root. The shaft is a portion that we could see above the scalp, and root is it's beneath the scalp. And the root has also a follicle. From this follicle, the root develops, and then we have this hair growth outside the scalp. And as you can all see, we have got a hair bulb, and the hair bulb is receiving blood vessels. So as when we consult a doctor regarding the hair issues, first of all, he would ask about our nutrient supply. That is whether we are taking a nutritious food or else we are having any anemic condition and all. Why is it? Because the hair bulb receives blood supply, and from this blood supply, it is getting all the nutrients necessary for its growth. So the nutrient supply by the blood vessel is very essential in the hair growth. And this is the hair growth cycle. We have got mainly 3 stages in a hair growth cycle. And the first one is anagen phase, and that is a growth phase. And in this phase, what happens is that the hair follicle gets its nourishment from the blood supply, and it enables the hair growth. That is what I said earlier, that in a nutritious diet is very much important while we talk of hair growth and hair fall conditions. So the first stage of the hair growth cycle is anagen, that is growth phase, and in that phase the hair follicle gets nourishment from its blood supply, and it leads to its growth. And the second one is catagen phase, that is a transition phase. In that phase, what happens is that this hair follicle slowly detaches from its nourishing blood supply. You can see in that picture, the bulb in the earlier picture, you could see here that hair bulb, and we have got blood vessels and papillae. This hair bulb and slowly detaches from this blood vessel, and what happens is that it is a transition phase, and slowly it gets to the next stage, that is called telogen. That is, telogen phase is a resting phase. Here, without any nourishment, this hair follicle finally dies out and falls off because it had detached from the blood supply, and it is not getting any blood supply and nourishment. And finally, what happens is that it leads to its death, and eventually this hair falls out. This is the normal hair growth cycle in a human organism. And before going to this assessment, let us see what are the causes of hair fall or else hair diseases affecting hair. The major cause is one of the major causes, hereditary. This hereditary plays a very important role in all majority of all the hair disease conditions, because as we could see, you could see majorly this hereditary pattern in the men. Example is alopecia. Now what happens is that there is male pattern baldness. The main cause of this male pattern baldness is hereditary. Okay, and the second cause of this hair disease condition is diseases affecting, some of the systemic diseases. Example, cancer, arthritis, some diseases like that. What happens is that our immune system gets weakened, and finally this will affect the hair growth. Then hormonal conditions. There also, for example, in hypothyroidism. In thyroid patients, you could see them complaining of hair fall and what thinning of hair, example. The next cause is medications and supplements. While we are taking some medications, example for heart problems related with heart problems, gout conditions, and high blood pressure medications, uh, these persons could face this hair falling or hair thinning conditions. The next one is radiation therapy. That also you are all familiar with. For example, chemotherapy. The hair is finely shed. And the other cause is stress. Stress also plays a major role in this hair fall. This is nowadays common in all the people, and majority of the what teenagers and majority of the persons in the age group of what 20 and 40, they are facing this so much of stress and what lifestyle diseases, and hence they are dealing with this stress. They are also facing this hair loss conditions. The next one is hairstyles and treatments. Hairstyles and treatments. You will see in this slide, there is a condition that is called traction alopecia. It is a condition related with hairstyle pattern. So some of the hairstyles will lead to what hair growth, hair loss, because what happens is that some hairstyles will pull out the hair from the root, and it eventually leads to alopecia. And the next one is hair treatments. Nowadays we are all doing hair coloring, straightening treatments and all, and these are all causing damage to the hair follicles, and this will also lead to alopecia. So these are the majority of the causes regarding the hair diseases. Now we will move on to assessment. How should we assess this hair disease conditions? The first one is onset, duration, and precipitance. That is when a person comes to you to consult for hair disease. First of all, you should inquire about its onset, how it started, when it started. Okay, that is, and how long it has been they are facing this problem. And the next one is precipitance. Precipitance, an example I have quoted earlier, that is hairstyle and hair treatments and all, and also some medications. So you must know about this precipitance. The next one is pattern. How is it affecting, which means on which area you are getting this more of the hair thinning. The next one is scarring. Scarring means once your hair follicle dies out, no more hair follicle will grow in that area. That is called scarring. Majority of this radiation therapies, it is very difficult that we could get back the hair growth back to normal. Why? Because there is scarring. That is, some of the hair follicles get damaged and no more hair could grow on there. So scarring is also important. Then shedding, breaking, or thinning. These three are the conditions what we could see in a hair fall. So first one is shedding, which means they are losing hair daily on what we could assess it that they could get 5 to 10 strands of hair, or else more than that. The next one is breaking. It happens when the tip of the hair, splitting of hair, and it got split and then it breaks off from there. So that is a condition of breaking. Then thinning. Thinning is eventually the density of the hair will become less, and you could see the scalp. That is called thinning. The next one is medical history, drug history, family history. I have told you earlier, these three is included in the causes of hair diseases. The medical history, what all medications they are taking. Drug history medical history, what all disease conditions they are having. That is, earlier I told you that arthritis, cancer, or else some systemic diseases. And the next one is drug history, what all medications they are taking. And then family history, hereditary pattern. Is there any hereditary pattern in this? Then hair care. how they take care of the hair. That is what usually how many days they wash their hair, what about shampooing hair, oiling. The overall care of the hair. How are they taking care of their hair? Okay. Then diet. First slide I had explained that as blood supply is very important. That is nourishment is very important for the hair follicle to grow up. So diet plays a major role in this hair disease conditions. Next one is examination. Examination includes two methods. One is inspection and the next one is full test. In the inspection, we should look for in the scalp for scarring, scaly, and erythema. That is there any scarring? Scarring means we could see a spot where no hair is there. That is, it is a condition of alopecia. But in scarring, what happens is that no more hair follicle is there. So from that portion, the regrowth of hair is very much difficult. Next one is scaly, whether the scalp is very much scaly. And erythema, is there any eruptions in the scalp? The next one is pattern. Is it diffuse loss of hair or else in patches it is losing? So that is regarding the pattern. Then look for its density and then hair quality. That is whether the hair is it is glued together, whether they are having any fungal infection or else. Okay. And the next examination method is full test. It is to assess the strength of the hair. Then investigation. These are the investigation we should go for in conditions of hair diseases. The first one is ferritin. Ferritin, it is very much important in females that we should have minimum of 80 of ferritin in females to have a healthy hair growth. So while investigating, we should go for these tests. First one is ferritin, then assessing hormones, that is thyroid hormone is very much important. Thyroid plays a major role in the hair growth and health of the hair. Okay. Next one is sex hormones and then ANA. ANA you all know. And then syphilis. Syphilis is a condition that I told you earlier. Medical conditions. So you should look for this condition, whether they are having this. Okay. Then scalp scraping. These are the investigations commonly done to assess the hair disease conditions. Now we will move on to our topic, hair disorders. So when we say about hair disorders, it can be of two categories. One is the condition in which we could see more of the hair. And the second one is condition we could see hair flows. Okay. So these are the conditions, these are the categories in hair disorders.
Ma'am, your slide is not moving.
Is it clear now?
Yes, ma'am.
Okay. Okay. So the first one is mole hair. The category mole hair. We have got two conditions. One is called hypertrichosis and the next one is called hirsutism. So these are the two conditions in which we have a hair disorder in which we see more hair growth. So first one is hypertrichosis and the next one is hirsutism. Okay. So this is called hypertrichosis. What is that? You could see in this picture a child with what his face is covered fully with hair, right? That is hypertrichosis. Hypertrichosis means it is excessive growth of coarse hair than the normal hair on any part of the body. Okay. And it is commonly found on the forehead, neck, or any area where coarse hairs are not normally found. And this is seen in several conditions like congenital hypertrichosis or else some internal malignancies like gallbladder, rectum CA and all. And also while using some medications like corticosteroids, some drugs containing corticosteroids. If they are on this medication, there is a chance to develop this hypertrichosis. So this is a hypertrichosis condition where we could see excessive growth of coarse hair than the normal on any part of our body. It's commonly seen on the forehead, neck, and any area where we could not generally see the coarse hair follicles. And then it is seen in the congenital conditions like congenital hypertrichosis, and also in CAs affecting gallbladder and rectum, and also while using medications containing corticosteroids. The next one is hirsutism. This one, I think you all have met in your clinical side. In your OP, you could have met one or two patients with this condition, hirsutism. It is commonly seen in women. That is a condition in women. It results because of the growth of dark coarse hair, male-like pattern hair growth on their face or chest or on other body parts. Okay, so this is what is called as hirsutism. This hair growth occurs because of excess male hormone, that is androgen, majorly testosterone. If they have an increase of testosterone in their blood, they will face this condition. And as I said earlier, majority of the females complaining with PCOS, they would be having this hirsutism condition. And so PCOS is one of the major factor causing hirsutism. And also Cushing syndrome, congenital adrenal hyperplasia, ovarian tumors, and some medications also lead to this condition. So this is what is called hirsutism, a condition in women that results in excessive growth of dark coarse hair in a male-like pattern. And this happens because of increase of testosterone in the blood, and it is associated with PCOS and also ovarian tumors, congenital adrenal hyperplasia, and Cushing syndrome. So what are the are remedies or medicines for this condition, hirsutism? In PCOS, we have got wonderful homeopathic remedies like pulsatilla, sepia, and all, and ignatia. And while treating PCOS, what happens is that once PCOS is cured, this condition, this hair growth will become less, and no more further growth of hair in this regions will occur. So first of all, we should find out the underlying cause for this condition and should treat that condition. When that condition is cured, this hirsutism will itself will retard its growth. Okay. And also some other medicines like spongia, pituitrinum, these are also helpful in treating this hirsutism condition. Next one is hair loss categorization. In hair loss categorization, we have got two categories. One is non-scarring and the other one is scarring. In non-scarring means we have got hair follicles there. So the regrowth of hair is possible, somewhat possible, not for 100%, but we can have somewhat hair growth in the non-scarring category. In the scarring category, there are no more hair follicles are available. So the regrowth of hair is very much difficult on these conditions. Okay. So in scarring, we have this chronic discoid lupus erythematosus, then lichen planus, lichen sclerosis, morphia, pseudopelade. These are the conditions where scarring of the scalp occurs and regrowth of hair is very much difficult. In the non-scarring category, we have got diffuse alopecia, alopecia areata, androgenic alopecia, traction alopecia, and trichotillomania. These are the conditions coming under non-scarring category. The first one is Telogen effluvium or else diffuse alopecia. It is the most common variety of alopecia. Now, it happens because, as I said earlier, in the normal hair growth cycle, we have got 3 stages, right? Telogen, catagen, and then it comes to the last anagen. So, in this condition, what happens is that from this anagen follicles directly come to the telogen phase without the intermediate catagen phase. So what happens is that they will start to die off, fall off suddenly. So more number of hair will fall off, and it leads to a diffuse pattern of alopecia. Okay. somewhat the causes, majority of the causes stress and strain. Okay. And what happens is that when we have any acute disease conditions like any infections and something, normally majority of the person will have this diffuse alopecia associated with the condition. And after 3 months, they will have this normal hair growth. And what until this all the hair have lost, this condition continues, and then the hair will grow back. Okay. When we met with an acute infectious condition, for example, patients what met with COVID-19, and some of the patients will come to our clinic and complain about hair fall after COVID. Why happens is that because of this stress and strain after this infection, this hair follicle will fall, die off and fall, and this episode will continue nearly for 3 to 6 months. And once all such hair is lost, and the stress has been subsided, the normal hair growth will begin. Okay. And this is called Telogen effluvium. That it is a most common variety of alopecia, and it occurs because premature precipitation of anescent follicles, moving on directly to the telogen phase without the intermediate catagen phase, as a response to stress and strain. Okay, this is a condition called diffuse alopecia or telogen effluvium. And these are all wonderful medicines which help to regrowth this hair and prevent the further loss of hair. Calcareous carb, sepia, natramine, sulfur, china, ignatia, acid phosphorus, acid fluor, and ginkgo minor. There are so many remedies apart from these remedies, and one of the things is in this condition, when a patient complains of the condition, first of all, you should give some medicine that could ameliorate their condition, and then you should eventually look for this constitutional remedy to prevent the recurrence of this condition. Okay. So whenever a patient comes to you with the condition of hair fall, you should definitely go for their constitutional remedy, because you should know the history, how it started and all, and you should first manage with some acute remedies to ameliorate the condition, and then you should go for the constitutional remedy. Next one is alopecia areata. This is the second. I mean, this is majority of the problem faced by both children and adults. Okay. You could see this condition in children and also in adults. This is, you could see patches of hair loss in the scalp. One or multiple areas where the hair is lost, and patchy scales on the hair, scalp. Okay. When this loss of hair is complete with that is this alopecia areata, it is again classified into two: alopecia totalis and alopecia universalis. In alopecia totalis, you will have loss of hair along with the scalp. You will have loss of hair from the other parts of the body also. It may happen or may not happen. It is a condition alopecia totalis. That is, you will have loss of hair from the scalp is complete, without loss of hair from any other part of the body. In alopecia universalis, you will have loss of hair all over the body. This complete loss of hair all over the body. That is, you could see hair loss and hair loss of eyebrows, eyelashes, scalp, everywhere. The loss of hair is prominent. That is complete loss of hair. It is called alopecia universalis. When there is complete loss of hair in the scalp, with or without loss of hair on any other part of the body, it is called alopecia totalis. And alopecia areata is a condition where you could see patches of hair loss in your scalp. There may be one or multiple region. Okay. And here the homeopathic medicines include syphilinum, phosphorus, acid fluor, bacillinum, lycopodium, natramine, calcarea carb, rose marianus, visbadin, and ginkgo minor. You could see acid fluor has done a wonderful result. Acid fluor has got a wonderful result in this condition of alopecia areata, and also syphilinum. vinca minor, etc. Here we could manage it with some acute remedies. The hair will, I think, with 3 to 6 months, the hair will regrow on that patchy area and it will cover the area. The next one is androgenic alopecia. It is commonly seen in men. That is male pattern baldness, it is called. This is because due to androgenic stimulation of predisposed hair follicles. That is, what happens is that there is reduction in the anagen phase and increase in number of telogen follicles. So what happens is that there is more hair fall than hair growth. Okay. So that is in the anagen phase, there is a reduction in the anagen phase. That is, the hair follicles are not getting nourishment and they are not growing. And telogen follicles in the telogen phase is more. So what happens is that hair fall will become more and hair growth is less. This is the conditions in male pattern baldness. It is earlier I told you that hereditary plays a major role in this condition. It is believed to be transmitted as an autosomal dominant character. So when a patient approaches with this androgenic alopecia, definitely we should go for the hereditary prominence. Okay. And then initially there is backward recession of frontal hairline followed by loss of hair from vertex. That is, they will be saying what they are losing hair from this frontal hairline, and then we could see the hair loss from this vertex, and the hair will be present over the occiput and side. Okay, this is the condition called androgenic alopecia. This is the condition traction alopecia. In the causes of hair disorders, I have told you some hair styles will lead to hair fall and finally causes alopecia. This is one such condition called traction alopecia. That is prolonged traction on the hair due to hairdressing style. You could see in this first picture that when the picture on the right side, she was having hair follicles on her frontal hairline. But due to what continuous the hairstyle pattern, what happens is that because of this stress and strain she is giving to this hair follicle, what happens is that her frontal hairline has receded back and led to traction alopecia. Once there becomes scarring, no more hair will grow there. Okay, so initially what happens is that hair will start to break and then it lead to alopecia. So after scarring, hair does not grow over there. Okay, this is the condition called traction alopecia. And the next condition is trichotillomania. Trichotillomania is what associated with some mental disturbances. While we are having some emotional disturbances, we could see some people always picking off their hair. They will start pulling their hair and what breaks it off. And this will lead to difference in length of the hair. Okay, somewhat they will have a hair with short hair on their frontal hairline and will have lengthy hair on their back. And eventually this will they will pull out this hair from its root, and once there also when scarring happens, no more hair will grow. And this is totally related with their emotional disturbances. This is seen in children and adults with mild to severe emotional disturbances. Loss of hair may also be seen in eyelashes and eyebrows also. Hair on the patch vary in length because what happens is that they always break it and pull out the hair. So they will have hair loss from this frontal hairline. Okay, this is called trichotillomania. This is one of alopecia areata cases of mine. Here I don't have the first picture. The picture on the left side is after 3 weeks of medication, and on the right side it is nearly 1.5 months. And I have given Cifilnum 1 single dose and acid fluid and vinca minor BD. So this is a condition conditions regarding hair. Okay, I hope everyone enjoyed it and everyone understood this session.
Thank you, ma'am, for your valuable presentation. Now
Thank
is
you.
the time for queries. Participants who wish to ask questions to ma'am can please type in the chat box, or you can raise their hand so that you will be unmuted. Ma'am, I have a question, ma'am. When we treat fungal infections in genital area,
Yeah.
it has a tendency, it will subside first, and it has then a tendency to relocate to the scalp area. Why is it like that, ma'am?
Because you are having only acute management. You should go for this constitutional remedy along with some intercurrent like bacillinum or tuberculum, some nosodes. Okay. So as an intercurrent, you should give any nosode once in a month, at least for 3 to 6 months to prevent its recurrence.
Thank you, ma'am.
Okay. Rainfall and dandruff experiences. Dandruff, definitely we have wonderful remedies, but along with our remedies, it is necessary for the accessory management. We should have a wonderful hair care to prevent this occurrence of dandruff. Okay, so phosphorus will give result in dandruff cases, and also we could not see it on all of a sudden. Patience is necessary while treating with dandruff. Phosphorus, natramur, these are all wonderful remedies to treat the dandruff cases. And once the dandruff is reduced, as I told earlier, accessory management is very much necessary. And vinca minor and jaborandi tincture, vinca minor tincture and jaborandi tincture, these will help in reducing this dandruff. Yeah, if the scarring happens in psoriasis, there is very much difficulty to get back, reverse the hair growth. Because in these conditions, what happens is that it will affect the skin epidermis, and if the follicle is not there, we cannot do we cannot reverse the condition of hair growth. Majorly in psoriasis in early stages, we could definitely reduce this hair fall, and in the earlier stages, if we treat accordingly, we could get back the growth. Once scarring occurs, we cannot do anything.
Ma'am,
Yeah,
what are bad effects of treating hair conditions with the help of corticosteroids?
that is with the while using this corticosteroids, you will have a hormonal imbalance, and finally this will lead to hair fall, and eventually a severe hair fall will lead to alopecia. So what happens is that you should treat this condition. That is what I told earlier. When we in PCOS, if we look at them, they are having this hormonal tablets. So as a side effect of this hormonal treatment, they will have this hair fall. So once PCOS is managed and it is cured, you will have this hair falling reduced. And hair growths, external application for hair fall. External application for hair fall, that is what I told earlier. Vinca minor, jaborandi, then mentha piperita. These are all wonderful hair applications for the hair fall. Then hair growth in the ear of elderly. I have not treated such condition earlier. I have not met with such condition, and exactly I don't know, but I think you should go for some constitutional remedy or something, because there we should reduce this hair growth condition, right? So there also, I think there will be some hereditary pattern there. So you should treat accordingly. I'm not sure about that. I will just search about this condition, and is there any medicine available, or is there any cases that has been treated successfully? I will let you know. Definitely, I will let you know. And then in case of patches of hair fall in kids, there I told you earlier, in alopecia areata, acid flow, syphilinum, bacillinum, or vinca minor, these are all doing a wonderful job. Acid flow 2 doses or 3 doses will definitely get you the condition reversed. You will see the hair follicles coming out within a week. How to use this external application? You should mix it with the oil hair oil and apply on the scalp and leave it for half an hour. Do not use any harsh shampoo or conditioner. You can shampoo your hair once in a week or twice in a week. And you should why if you're having any complaint with sinusitis or allergic rhinitis, do not leave the oil for more than half an hour, or else you can leave it for more than half an hour and then wash it off.
I hope the queries are over. So now now I invite Lakshmi Cycle to deliver the vote of thanks.
Good evening, everyone. On behalf of all, I would like to thank Dr. Arya for her wonderful session on the topic diseases of hair and its homeopathic management. Ma'am, it was really a useful session for us students, ma'am. And we see many of these alopecia conditions in our clinics, and ma'am has given a very great useful session regarding the different conditions as well as the remedies used for those conditions. Thank you, ma'am. It was really a useful session.
Thank you. Thank you so much.
I would also like to thank the coordinators of Ifph for arranging such wonderful sessions each week. Once again, thank you all.
Ma'am, I'm sorry, ma'am. There is one more query.
Okay. How to select shampoo available in market for patients? That is what I told you earlier, that it depends upon the hair texture of every patient. Some may be having some oily scalp, so that their oil production will be high. And then at that time, you should go for some shampoo with it does not make your hair oily. And some may have this after shampooing they will have a very dry brittle hair. So at that time you should go for shampoo containing some essential oils. So you should definitely look for the texture of hair of the patient and then advise the shampoo. And moreover, you should go for a detailed study on the shampoo available in the market, and you should find it condensed, and then you should prefer any shampoo. I don't prefer any shampoo. Most probably, I will be advising some natural ingredients or some natural methods to wash off their hair. Or else, if it's necessary for them, they can have their shampoo their own preference once in a week or twice in a week. While using this, our medication, personally, I do not advise them to use any other shampoo available in the market. And also, you can go for Arnica shampoo and hair growth shampoo available in the our medicines. Arnica and hair growth shampoo, they are all our medicines, and you can have them. You can advise them to use these products. But one thing is for sure, along with this external application, it is very much necessary that in all of the hair disorders and hair fall conditions, it is very much necessary that the internal medication is necessary, and also the diet management.
Thank you, ma'am. So the queries are over. So let's wind up the meeting. Thank you, ma'am. Once again.
Thank you. I would also like to thank the organizers of this session, Ifph, and I was very much happy to perform in such a big platform. And thank you for giving us chance, and hope to see you more in more sessions. Thank you. Shall we wind up the session?
Yes, ma'am.
Okay. Thank you. Thank you all.